Hello, my name is Dr. Carlo Oger, and I am an emergency medicine doctor. In this video, I'm going to talk to you about the stomachache. What happens when you have a stomachache? Well, when you have a stomach ache, you have pain or discomfort in your belly. Sometimes that's the only symptom you have, but other times you can have other symptoms like burning in your chest, also known as heartburn, burping, bloating, which is a feeling as if you're full throughout your belly, feeling full too quickly when you start eating, etc. When should you see a doctor or nurse about a stomach ache? Most people do not need to see a doctor or nurse about simple stomach ache, but you should see your doctor or nurse if you have a bloody bowel movement, diarrhea, or vomiting. If your pain is severe and lasts more than an hour or comes and goes for more than a day. If you cannot eat or drink for a few hours. If you have a fever higher than 101. If you lose a lot of weight without trying to, or lose interest in food over time. What causes stomach aches? In some cases, stomach aches are caused by a specific problem, such as a stomach ulcer, which is a sore inside of your stomach, or a condition called diverticulitis, in which small pouches in your large intestine get infected. But in some cases, doctors and nurses don't know what causes stomach aches or other symptoms that happens with them. Even so, doctors and nurses can usually treat the symptoms of stomachache. So what treatments help with stomach symptoms? If your symptoms is caused by a specific problem such as an ulcer, treatment for that problem will likely relieve your symptoms. But if your doctor or nurse doesn't know what is causing the pain, he or she might recommend medications that reduce the amount of acid in your stomach. These medicines often relieve stomachache and the symptoms that come with it. Some of these medicines are available without a prescription. Can you do anything on your own to prevent the stomach ache? Yes, the foods you eat and the way you eat them can have a big effect on whether or not you have pain. To lower your chances of getting a stomachache, do the following. Avoid fatty foods such as red meat, butter, fried foods, and cheese. Eat a bunch of smaller meals during the day rather than 2 or 3 bigger meals. Stay away from foods that seem to make your symptoms worse. Avoid taking over-the-counter medications that seem to make your symptoms worse. Examples include aspirin or ibuprofen, brand names Advil or Motrin. Some people, especially kids, sometimes get a stomachache after drinking milk or eating cheese, ice cream, or other foods that have milk in them. They might have a problem called lactose intolerance, which means they cannot fully break down foods that have milk or milk-type products in them. People with lactose intolerance can avoid problems caused by milk if they take a medicine called lactase. Lactase, sample brand Lactaid, helps your body break down milk. Some foods come with it already added. If your stomach ache seems to be related to constipation, meaning you don't have enough bowel movements, you might need more fiber in your diet or a medicine called a laxative. A laxative are medications that increase the number of bowel movements you have. Taking in a lot of fiber helps increase the number of bowel movements you have. You can get more fiber in your diet by eating plenty of fruits, vegetables, and whole grains, taking fiber pills, powders, or wafers. Is stomach ache the same for children as it is for adults? Generally speaking, yes. Children get stomach aches for the same reasons as adults do. As with adults, doctors and nurses often do not know what causes stomach pain in children. But in children, stomach pain is often triggered by stress or even anxiety. For them, it's especially important to pay attention to psychological and emotional problems that might be making the pain worse. I want to thank you for watching this video. My name is Dr. Carlo Oger, emergency physician. For other videos like this video, please go to PatientEducation.Video. Thank you.